I do not specialize in it. I mean, not in that. I just like choosing some jobs.
So you wrote something on the...
Oh yes, it's just muscles basically, so that I
You
can
want it?
remember. No, it's okay. So, does anyone know how many muscles Mauni is related to the jaw? I know you have. I already written it down, but 6, right?
6.
Okay. More or less.
Yeah.
6
6.
6. No, 6 on one side. Okay. Do you know which one opens the mouth and which one closes the mouth? You are not doing what
Lateral
you're
open.
doing.
Yeah.
Pterygoid.
Masseter and medial pterygoid close the mouth. Lateral opens.
And what else?
Temporalis.
What does temporalis do?
Temporalis close.
So that's masseter, temporalis, and what?
Medial.
To close. What opens? Lateral.
Lateral.
The other two muscles are a little bit harder to do. So it's like the glenoid
Hyoid.
and
The
the
high gastric.
yes. Okay, so it's all attached to the hyoid one. Okay, so that mostly yeah, but the muscles that you normally treat are the muscles if you talk about them. So now I'm gonna get you all to palpate those first, because then you have an idea where they actually are. So can you please tap?
So no, we record all our conference.
Oh, right.
Huh?
不记得 Anyways, first things first, you have to actually have to observe the jaw, okay, bilaterally. So you have to look at your partner, whoever that you are. Okay, so I'm going to sit, please, guys. You're not going to do anything standing. So shy.
I'm already sitting already, much shy.
Why you wear the dress so fast?
I will be digging.
Okay, so see how you observe it. Sit, I don't really care. Take yourself. At least someone.
And why?
So
You have
Chicken waffles. Stuck inside.
chicken waffle.
yeah.
Okay. So you observe bilaterally.
Okay, open the
You're looking for a few things, obviously. Deviation and deflection. So neck. Cervical. That's quality. Okay. If it's translation, then you're looking at probably some disc derangement, and they always come to the translation part. So you need to feel. Okay. So other movements as well include protrusion and lateral excursion. Okay, so you have to check all that in range of motion later. That's what you're gonna feel. So you're gonna get them to and see whether there's any pain or discomfort while doing that. And then when lateral excursion is not, no, it's actually closed mouth, and you actually feel how much they're actually moving. Okay, one very good way to see the lines, get them to slowly part their lips, and you use the lines between the first two front teeth, and you should see them sort of connect.
Cannot.
Now, sometimes when you open the mouth and you see a little bit of,
Oh, I thought.
okay, but you must sort of, sometimes the teeth is the one that's causing the
Yes,
okay?
teeth, okay.
Right? But you give it as like a landmark basically. Okay, and then you assess, and then you get them to see which one does more than the other. So, you gotta remember the TMJ is like a hinge, so around it has ligaments as well, protecting it other than the disc. So when you do lateral excursion, keep in mind the lateral and medial pterygoid as well as the ligaments. So the three main ligaments is the lateral ligament, the sphenoid,
Our patient's
How big is it?
family member is ill.
Wow. Wow. Hot cakes.
got my picture next to
Hot
it.
cakes. Hot cakes.
Three main ligament.
Lateral ligament, and then glenoid, sorry, I'm not very good, I told you, the anatomy part. Basically, that three main ligament, the most one that causes the pain is actually the lateral ligament. most of the time, not all the time. Okay, so now palpate. So you all palpated. Did you all find any trigger points? So now you inspect, you palpate. So she's got a good amount on the left side.
But then if you open, this one come out first.
So which one? Does anyone have?
A bit.
On the?
Left.
The right one come out first.
Okay, so you might be pushing into that. Right, anyways. So what you all need to know is which, so you've got the masseter, the temporalis, okay, and the outside. The digastric, okay, there's two bellies, digastric, the anterior and posterior digastric. So you try from here and you just pop it and see whether you can get anything. And then the glenohydrate.
Okay. This is the masseter insertion.
And you pump it and see whether you can find any hypertonic muscle or any pain or discomfort too. And you can do it while opening, and you can actually.
The patient has to open the mouth.
Not yet, you can
while
actually.
talking.
No. You can actually, if you want, because it opens the mouth, right?
Yep.
So sometimes you might find a bit of tenderness, but don't poke and prod too much.
No, what I'm saying is when you palpate, right?
Close.
Does it close?
Okay.
We get spasm when I open yawning.
Sometimes,
you get
yeah.
you get spasm. Okay.
Yeah, it's quite funny. Right.
Okay.
So you pop it usually behind the camera. You need to feel stuff. Muscle, sorry, not stuff.
You open?
So then you look,
Right one I feel more
and
hypertonic.
then make sure
Yeah,
you
I feel
find the
like-
tendon, the temporalis tendon. Okay, we've got a tendon. It's just above
Open again.
the NJ, and it's quite tight sometimes. Okay, so you need to enhance the popping.
No
If you can't
deviation.
find anything, just use the.
No, you can move around. Yeah.
Oh, this one
And then it's normally you can find
It's
the
moving.
muscle.
It's not more this side.
This is moving forward first.
Okay, so now, so you palpated that now inside.
Yeah.
Okay.
Oh no.
You came on.
So you
Yeah,
scan.
Do you mind?
You went.
No, it's your face only. Do you mind?
Yeah, don't mind.
Right, you are. Okay, so can you find, okay, what can you find inside?
Lateral thyroid.
So you palpate both of them and really find the lateral and medial. Okay, the makara is actually up here. Go up and find.
That's the lateral, right?
Yes, and then the medial. Okay, palpate both of them. And then you make sure that you feel around the joint as well. Yeah. So if you go, if you can go into the joint, okay, this is all relaxed. You can actually do it lying down, it's always better. So you push and prod into the joint. Sometimes you'll find that in the lateral side may be painful. Maybe this, then it could be the lateral ligament. Sometimes anteriorly it could be, you just palpate inside and feel around basically. Right?
Feel.
And since, no, it's best to do it now.
Can I just do it in my own mouth?
No,
Where's your ikan pari?
because it doesn't count. You have to palpate on someone. Okay? Palpate, Yusri.
Palpate usually.
I'll be there.
Why you use the middle finger?
Why?
I usually use the index finger.
Yeah.
Traction the area that is tight. Orange traction. Okay, so now traction, right? Okay, this in his case. Turn to your left. Okay, so now contacts here. So get him to up a bit more. And traction. Okay, and you push here. Now the point is not to overstretch. Right, please, I don't want you to sit like that all the way. You just, okay, the other one you can activate here. And again, this is after assessment. Okay? Yeah. Trust this one. The back. And you do the line of adjustment. The line of direction is this way. Okay? Have you adjusted her since? Okay, so I need that way. That time I did quite
I think it's
a
better
lot.
if she sticks to the activator.
Yeah, activated. No, I did activate her.
But she is getting better.
So you get that, and then yeah, I prefer normally stretching first, and then adjustment comes later.
After the hour.
Okay.
Stretching is in like what you did just now.
Yes. Stretch. To be done with a little bit of gap opening. Now they can resist you as well, so they can do the same exercise while you're doing it. So push against my hand. Is it hold and relax, and then you push. Okay, so enough. That's right. So you do that as well. Okay. But I would prefer you all knowing where everything is first and assessing motion, palpate, get that jaw to move bilaterally, see what you can
You
actually
treat the
feel,
wrong jaw.
whether it's laxity of the soft tissue or whether the disc is giving you restriction. So do that and get that first. And palpate, know where you're palpating as well, which muscles you're palpating. And that will help you. Soft tissue should be your first line if there's no trauma. Okay, you can treat both, but better treat the hypertonic muscles. Okay, and you can find, depends whether it's a closing problem or an opening problem. So if it's, you know which muscle opens, which muscle closes, they treat those muscles. A lot of people don't treat it. Okay, but it's very sore for a lot of people.
But this time we cannot press too hard. We just
Yes, but what you do is you go along the jaw, and you can find tender spots, especially on the edge here. And even if you do that,
ouch.
sorry, you can feel it's very tight. And right, don't push onto the tonsils. That's not where it is. Okay.
Very hard to do.
Okay, so it's basically here. So okay. Here. So.
Ouch.
So that's more here. Okay. Right. Palpate. So please palpate and know where it is. What are you doing?
This is what?
Don't push.
This one like all accessory. Only right.
Yeah. You're only looking for just the opening or effect with the gastric. And you need to palpate.
Okay.
Okay. She's get what you mean. Okay. Right.
Anything
So,
else?
no, that's it for today.
Okay.